Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about public health, infectious diseases, vaccines, and vaccination. I'm Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, good afternoon, good evening to those who are watching us or listening to us today.
In our edition today, we cover 5 topics. 2 new studies add to the growing body of literature on lasting effects of long COVID. Melvin reviews 22 viruses who persist in semen, and these viruses have pandemic potential. We speak about Rwanda's Marburg outbreak declared over, and I have 2 pieces of good news regarding malaria. And we will start today with Melvin, and we will look on long-lasting effects of long COVID. What is the story, Melvin?
Yes, so these are 2 new studies that add to the growing body of literature on the lasting effects of long COVID in the body. In the first, a study of 114 patients with long COVID in Israel, researchers found high rates of depressive disorders, generalized anxiety disorders, sleep disturbances, and reported cognitive changes among those diagnosed with the condition. This first study was published in the BMC Infectious Diseases, and it was an online survey given to long COVID patients composed of several established questionnaires, including the Generalized Anxiety Disorder or the GAD-7 for psychological distress. And the participants had an average age of 44 years old, and 29 were men and 85 were women. And the high rates of sleep disturbances and cognitive changes, including brain fog and memory loss, were the most significant findings. Now, the second study, it's a study by the Center for Disease Control and Prevention, the CDC. They found that the prevalence of long COVID-19 in the U.S. population in 2021 was almost 30%, and 77.2% of those with long COVID had not returned to pre-COVID health within 8 to 60 weeks after infection. And in this study, they used data collected in 2021 to assess long COVID prevalence. And the authors found that 30% of those infected with COVID in the pre-Delta period, so this was before the Delta variant, and this was March to December 2020, they developed long COVID or post-COVID conditions, or PCC, and among those, 3 out of every 4 patients did not return to prior health within 60 weeks of initial infection. And I think this is good for us to know, because understanding their symptoms and clustering may provide insight into the pathology, pathophysiology, and severity of these post-COVID conditions, and also to remind us that these conditions are not made up. They are actually real.
Very interesting. And I like what you said, and I like the wording in the headlines, speaking of condition and not disease, because we don't know if there is one cause or several causes, or we don't know the details. Mm-hmm. And I guess it is difficult to diagnose with absolute certainty. So I like the term condition at this point. But what you highlight also, this may be sort of a plague in the near future, right? More and more people accumulate this long COVID, and in the end, we will have a large population with long COVID, and it doesn't go over. That's the basic message here, right?
Yeah, and although one good point, I guess, is that those previous versions of the virus, the alpha, beta, delta, right? Those that we were still focusing on, those were the ones that caused more long COVID conditions, and the newer variants seem to not do that. So I guess that's the good news.
That's a good news. Let's look for good news in our show today. So you review the viruses with pandemic potential that persist in semen. So what's the story here?
Yes, so a new systemic review of over 370 studies reveal that detection of 22 viruses in human semen following acute infection, including pathogens with pandemic potential. And the study was published in the Lancet Microbe and shows that only 9 out of the 22 viruses had evidence of sexual transmission. The persistence of viruses in semen has really implications for ongoing disease transmission, embryonic development and fertility, and also the development of drugs and vaccines. And infectious semen has also contributed to recent outbreaks of Zika virus disease, Ebola virus disease, and Mpox. And these are just some of the pathogens, to name a few. In the review, the authors also examined the evidence of viruses in semen as well as viral persistence and how many days after the onset of illness that viruses are viable in semen. For example, Ebola virus has the longest viral persistence, detected 988 days after discharge from an Ebola treatment unit and 965 days after the onset of illness. The maximum detection of Zika virus in semen was 941 days after onset of illness, but the median persistence was 57 days. The shortest duration was 8 days after the onset of illness for Chiasanur forest disease, and the maximal detection time for other viruses was 21 days for yellow fever virus, 22 days for West Nile virus, and 37 days for dengue virus.
Melvin, that brings to my mind that I think nobody ever systematically looked for different viruses and for the duration of persistence in semen, right?
Yes.
Look,
this is the first one.
I wouldn't know about enterovirus. I wouldn't know about human metapneumovirus, influenza virus, anything like that. For most viruses, I wouldn't know if somebody ever studied this, but there is a list of persistence and there were not too many. You said you spoke about 373 that were included in this review. So how many of these 373 were really looking into different pathogens, but the 22 that you mentioned here in the paper?
So the 373 were the studies, not the viruses. And
okay.
in those studies that they looked at, they detected 22 viruses in human semen.
Okay. But there is no systematic review, like going through all the viruses from A to alpha virus to Z, like Zika virus, looking through all viruses, how long they persist in semen. That's the story that I was asking for.
No, I don't think so.
Yeah. Very interesting. So more research to be done on that one. Very interesting. Yeah. I mean, the danger is that they have pandemic potential, right? So if you have sexual intercourse and it's still in your semen, there may be another case and you thought the pandemic is over, but it isn't. 900 days persistence is 3 years, right?
Yes. It's a long time.
Very interesting. And you have good news, Melvin.
Yes. So the Rwandan government declared the end of the country's Marburg virus outbreak after passing 42 days with no new cases since the last patient was discharged from the hospital. And the time period represents 2 virus incubation periods. So this outbreak was declared on September 27 this year, and this was the first outbreak in Rwanda involving this particular virus. And the event resulted in 66 cases, 15 of them fatal. Most of the infections were reported in healthcare workers who cared for their colleagues and other patients at 2 hospitals in Kigali. And the case fatality rate was about 23%, which is at the low end of the range, right? Because we always say that for Marburg virus, the range is around 24 to 88%. So this is around the lower end of the spectrum. And this success was really because of the coordination of everyone in Rwanda, the local WHO in Geneva, and really the robust response by Rwanda shows how committed their leadership is. In spite of their resources, they were able to put this strong response, strong health system. And it really reminds us that in public health emergencies, it's important for countries, for localities to have really good and robust health systems to really safeguard the health of individuals and communities.
Thanks, Melvin. Very good news. And I have 2 stupid comments. The first one is Marburg is a city in Germany, and the message on the slide here, we defeated Marburg. This is really funny. Let me put it this way.
Yes.
The second,
it's funny because People who don't know that Marburg is a virus
Yeah.
might think that Marburg is the city in Germany, right?
Right. Right.
Yeah.
And the second is I've been to Kigali last year, and I really admire the country and its people. It's a beautiful place. If you ever have the opportunity, go there. It is absolutely safe. It has a stable political system. It has very good infrastructure. So Rwanda is really one of my favorite countries in Africa. And if I ever have an opportunity again, I'll go to Rwanda. It is really good to be. And congratulations to our public health people in Rwanda. Very good. And Melvin, having said this, it is my turn with the good news. Egypt declared malaria-free by WHO. They had 3 following years of proven interruption of indigenous malaria transmission by Anopheles mosquitoes, and they were certified malaria-free by WHO on October 20th, 2024. Very good news. And now Egypt is the 3rd country in the WHO Eastern Mediterranean region after United Arab Emirates and Morocco to be granted malaria-free certification. They are in the list of the globally malaria-free countries, number 44 now. They certainly need continuous efforts because the area, apologies for the misspelling there, the area around Egypt still has 94 of all global malaria cases in the neighborhood. So they really have to keep up all efforts to make sure they stay malaria-free. And the way they do this, I listed some of the items they do. It's access to healthcare for diagnosis and treatment, usually free of charge, vector control measures, and then access to medical care for regional migrants. Very important. They come to Egypt, they may bring malaria, and then there may be transmission again. But again, they have medical care for free for migrants when it comes to malaria. So congratulations to Egypt. Melvin, any questions, comments, remarks?
Well, I think this is great news because, as we know, malaria is as old as civilization itself, as old as tuberculosis, or I don't know which one is older, but they are one of those really old diseases. Yeah. But like you also mentioned, because they are surrounded by countries with malaria, they have to, I guess, work with those countries so that all of them in the region will be malaria free. Otherwise, the countries with malaria can still go to Egypt and bring malaria there again.
Yeah. So very good news, and I have one other good news about malaria, and that is spatial emanators are effective in the control of malaria. And I have to admit, I haven't heard of the term spatial emanators before I read the article. So spatial emanators are also known as spatial repellents. They are vector control interventions, and they are designed to prevent mosquito-borne diseases. They work by releasing a volatile chemical into the air, and that creates a protective bubble that reduces human vector contact. From design, they are typically a thin sheet of plastic or nets or mesh on a frame, and these structures, they have an emanator, and the emanator is usually transfluorine, and that is then evaporating into the air and creates this bubble. Now, they function, number one, by repelling mosquitoes, number two, by interfering with mosquitoes' host-seeking and feeding behavior, and some of these emanators even kill mosquitoes directly or impact their reproductive behavior. There have been trials in the past, and there are ongoing trials. There's one trial from Indonesia, in the study in Samba, Indonesia. There was a protective efficacy of 33% for malaria infections and 40% against overall infections. So they are working, and this is now a study done in Kenya. And what they did here, this was a prospective cluster randomized control trial in a county in Kenya. And the net that they used was transfluorine based, and there was mass distribution of insecticide-treated nets. Investigator staff and participants were masked to cluster allocation. Again, it was cluster randomized. The infection incidence was measured by microscopy in children aged 6 months to younger than 10 years. It was done several times. There were 58 clusters, 29 intervention, 29 placebo, with more than 1,500 participants each. And they looked at two consecutive 12-month cohorts for first-time malaria and also for end-of-trial malaria, respectively. And the findings are that these repellents significantly reduce the hazard rate of first-time malaria infection by 33%, very consistent with the finding from Indonesia, and the hazard rate of overall new malaria by 32.1%, which also, again, is 10% less than what they found in Indonesia. No reports on adverse events were associated with the use of the repellents. I think this is overall very good news. If you use such an emanator in your household, transmission may still occur outside the household. And in fact, besides sleeping, that's what you do in the household. But most social interactions, and I guess even most mosquitoes, are outside the household, I would assume. So this is overall very good news that there is a significant reduction of malaria by using these spatial emanators. And I just brought you here the one of the graphs that were published with the paper. And in red, you see the incidence of malaria with the intervention, and blue without the intervention. And you see there is a clear difference, with the exception here of week 28. Other than that, the spatial emanator is working. And you see here, week 32 to 44, it is even significant. So again, this is very, very good news, and I'm very happy we could bring you good news today at the end of the year. Melvin, any comments?
I think even though we are now used to high numbers for efficacy in vaccines, because of COVID, right? Our target for efficacy is always like 80, 90%, but even though this is around 30%, this is 30%, right? It's good news, because I think it's reminding us that for mosquito-borne diseases, it should always be a multi-pronged approach, right? Not just one approach. This is one, which is very good. Then you add maybe early treatment for malaria for those who are infected, and then maybe the other 30% would come from vaccines, and then you will see a very significant impact in public health.
Yeah. So it's like stepwise approach, right? You add to your measures, to your interventions. And again, I like the story from Egypt and the way they did this there. Please read the full paper for learning about this. But it is really very good news that come to the year end. Having said this, I summarize, we talked today about the growing body of literature on lasting effects of long COVID, and that may impact our future in public health. Melvin reviewed the viruses who persist in semen and who have pandemic potential. We had the good news about Rwanda, which declared the Marburg virus outbreak over. And I brought to you Egypt declared malaria-free by WHO and malaria prevention using emanators. Now, this was our last podcast for the week, and we have 6 quotes for you to finish the year. I like very much, be like a stem cell, differentiate yourself from others.
The chapter you are learning today is going to save someone's life tomorrow.
Pay attention, only a doctor can teach how to love life.
Study to save lives.
The good physician treats the disease. The great physician treats the patient who has the disease.
I love clinical practice, but in public health, you can impact more than one person at a time. The whole society is your patient.
With that, we thank you for listening us for listening to us in 2024. We wish you a wonderful slide into 2025 and hope to see you again next year.
Thank you, everyone. Stay safe.